I think so. No, there are only two students only. We will wait for one more 5-10 minutes. Okay. Then we'll start the class, please. Okay. We'll wait for one more 5 minutes. Yeah, good evening to everybody. Can you see my slide, please? Yeah, am I audible to you? Good evening to everybody. Am I audible to you?
Good evening, sir. You're audible.
Yes.
Okay. Can you see my slide, please?
No, sir.
No?
No, sir.
Can you see my slide now?
Yes, sir.
Okay.
Yes, sir.
Yeah. During the last 3 days, we have learned about the BAM request rules. Then secondly, on second day, we have learned about what are the various on-site, off-site treatment options. And also, we have learned on on-site and off-site disposal options of various biometric waste. And yesterday, we also have learned what are the various burn technologies and non-burn technologies which can be used for the purpose of treatment of biometric waste. And also, apart from that, we have learned how the liquid waste generated from hospitals can be treated and disposed in compliance to the discharge norms given under the biometric waste rules. Today, I think so. Today is my last class, and I'm going to take up today what are the various international treaties relating to the waste management in healthcare sector, or what are the various policies are there. Also, we see some of the issues relating to international treaties and all. You all learned, you all seen this one. I think so. I don't want to repeat once again. As far as the India is concerned, we have got various provisions which includes Water Act 1974, Air Act 1981, and under the Environment Protection Act since 1986, whatever the rules are there, that is being notified under the Environmental Protection Act 1986. We call it as the Environmental Protection Act. We call it as Umbrella Act. All the rules are notified under the relating to the control of pollution is concerned. All the rules are now notified under the Environmental Protection Act 1986 only. Now there are, apart from these, for the individual countries, they got their own regulations for control of pollution. Apart from that, there are some international policies or international issues are there relating to climate change, biodiversity loss, deforestation, marine degradation, expanding trade and consumption. Therefore, all these things issues are also dealt at the international treaties. The today's class is confined to the international policies related to waste management only. Therefore, what are they? One is relating to Montreal Protocol. We see what is the Montreal Protocol. We also can have a look at the Basel Convention, which is meant to control the transboundary movement of hazardous waste. Means waste cannot transport from one country to other. Stockholm Convention on persistent organic pollutants, and fourth one we'll see on Minamata. Actually, ये Minamata है, ये mistake है इसमें, spelling mistake है. Minamata Convention on mercury issue. Therefore, anybody heard of this international treaties, please, by chance? Anybody heard about the Montreal Protocol? Yeah, anybody heard about the Montreal Protocol? No, if no, say you can say yes, otherwise no.
No, sir.
No. No. Okay. Let us see the Montreal Protocol. This is the international treaty actually, in order to control the ozone depleting substances, release of ozone production and its use, and also release of ozone depleting substances into the atmosphere. This Montreal Protocol is there. You all know atmosphere can be having different stratus. One is troposphere, stratosphere, hemisphere, and other, and so on. just above the Earth surface. If you take this is the Earth surface, just above the Earth surface, we'll have the atmosphere can be categorized into 4 categories, 4 layers. It has got troposphere, stratosphere, and other 2 categories are there. And in stratosphere, there is one layer called ozone layer. You can see here in the brown color is a stratosphere layer above the Earth's surface, and black color layer it is showing as the troposphere above the Earth's surface. In a stratosphere, there is one layer called ozone layer. Ozone layer. What is the purpose of this ozone layer is? It always controls the harmful ultraviolet radiations. It filters, then it allows to pass through this layer the ultraviolet rays which are not harmful to the humankind and other the living organisms on this earth. Therefore, main purpose of this the ozone layer is to filter these ultraviolet rays, and which are not harmful. That rays only it allows. Now, because of and this ozone layer will be there somewhere around 10 to 50 kilometers above the Earth's surface. Maybe around this height is around 10 to 50 kilometers. And ozone is nothing but is a diatomic molecule composed of 3 oxygen atoms, and it is a dynamic component of Earth's atmosphere, and it is naturally formed and under ultraviolet radiations only. Under sunlight only, this ozone layer naturally forms above in the stratosphere. The main purpose, main advantage of this ozone layer is the filters ultraviolet rays which are harmful to the humankind or any living organism on this earth. It allows only the ultraviolet which are not harmful at all. Therefore, this is about this. Because of the human actions, now we are depleting some substances like we call it as ozone depleting substances or compounds. What are they? There are like chlorine, bromine, the halocarbons such as methyl bromide, methyl chloroform, carbon tetrachloride, and families of chemicals known as halogens, mainly the chlorofluorocarbons and hydrocarbons. Therefore, these are the ozone depleting substances. These ozone depleting substances are used by the humankind for our own activities, and this will reach up to the. Apart from this, there are some the natural sources are also there, like sources like volcanic eruptions. Volcanic eruptions also causes the reaching of this sort of ozone depleting substances up to the ozone layer. They also try to remove this ozone layer. Therefore, thereby causing, we call it as a holes in the ozone layer. That means when there is a holes in the ozone layer, the harmful ultraviolet rays pass through this ozone layer. No filtration happens. Therefore, it is going to cause impact on the humankind and other living organisms on the earth. Therefore, this main protocol, of course, we have prepared action plan. The action plans are there since 1987. We have almost all complied with all the action plans. We have almost all reached our target. As per commitment made by Government of India, we have already achieved this. The commitment made by the Government of India as per the Montreal Protocol. What is this? Montreal Protocol is mainly for a substance that deplete the ozone layer, and it is an international treaty designed for regulating the production and use of ozone depleting substances. Means, therefore, as per this Montreal Protocol, main the action is in order to regulate the process production and use of ozone depleting substances, and to phase out production of ozone depleting substances. Therefore, use of production of fluorocarbons is the main aim, so that we are going to protect the ozone layer, so that it is going to be useful for the humankind on this living earth. Not only it affects the humans, it also reduces the crop production. It causes cancers. It also causes skin effects, skin radiations, high irritations, etc. Now, international treaties, it is the Montreal Protocol is signed on 16th September 1987 at Montreal, and entered into force on 1st January 1989 onwards, and ratified by 20 states. And apart from that, among that 20 states, India is also one of the country. And as per the commitment, we have done all the compared with all the action plans, we already met the targets given by under the Montreal Protocol. This is about this issue. Secondly, the second convention is international treaty is the Basel Convention. This convention is in order to avoid the transfer of hazardous waste from one country to other. Means earlier, if you take up, in olden days, the developed countries, they used to dispose of all the hazardous waste generated by them. They may be disposing into the developing countries like African countries, including India also. They used to dispose of this waste to our country, other countries, or they used to dispose of into the sea also. At the time, no rules are there, no provisions are there. Therefore, they used to dispose of even the hazardous waste into sea disposal. What they used to do is they used to put in drums, and that used to be disposed into the sea. Therefore, nobody was there to question, and that used to cause a lot of impact on the marine environment also. Therefore, in order to protect the environment by bringing measures to control and regulate hazardous and other waste disposals, this Basel Convention has been with mutual understanding of various countries. This Basel Convention treaty has been initiated in order to reduce and control transboundary movement. Transboundary movement means to the transfer of waste from one country to other. At that time, no rules were there. After this Basel Convention, anybody wants to transfer any waste from one country to other, it has to be done only with the prior consent. Means prior approval is to be obtained from, let us say, if ESA wants to dispose of any waste into India, then they have to obtain approval from India. Prior approval, prior intimation should be there. Then only such waste can be disposed of by ESA into our country. Now, after this Basel Convention, waste is not allowed from one country to other, not so easily without any prior consent. They will not allow, and waste is allowed only between the parties who are the signatory to this convention. Non-parties cannot transport any hazardous waste from one country to other. If they are not a party, they cannot transport any waste to other countries. And this mainly intended to prevent and minimize toxicity of waste generated, and prior the consent approval is required. Even if you want to dispose of any waste from one country to other, then they have to obtain the approvals or consent procedures to be followed to regulate the transboundary movement of the waste, so that if anything happens in the transit of waste from one country to other, they can take necessary precaution measures. Therefore, if there is a intimation, that is the main aim of this Basel Convention, is to control, to regulate, reduce and control of transboundary movement of hazardous waste from one country to others. And this convention opened for signatures on 22nd March 1989 and entered into force on 5th May 1992. Please kindly remember these dates. You have to remember these dates, please. And about 880 countries are parties to the convention. Haiti and USA, they are signed, but they are not ratified. Means they are not implemented these convention policies. India ratified the convention in June 1992 and brought into force on 22nd September 1990. We have implemented the policies as per commitment made by Government of India as per the Basel Convention. Till 1999, we don't have any rules relating to import and export of hazardous waste. In 2000 onwards, the rules have been framed even for import and export of hazardous waste. That's what we call it as hazardous waste management and handling rules, transboundary movement rules 2000. Since then, there are rules pertaining to import and export of hazardous waste. Even if there are some type of waste there where you have to obtain prior informed consent, we have to obtain approach, we have to obtain from the country to which we want to dispose of. Of course, the disposal of hazardous waste is not at all allowed for disposal. It is not permitted for disposal. The hazardous waste is permitted, transboundary movement of hazardous waste is permitted only for reuse, recycle only, but not for ultimate disposal. Therefore, this is about the Basel Convention and the Stockholm Convention. That is the very important issue, is the persistent organic pollutant. Anybody can say what is the persistent organic pollutant, please? What is persistent organic pollutant? Anybody can say, please? Persistent organic pollutant. It is there. By word itself, one can say something. Any pollutant which will be there in the atmosphere for a longer duration, and also that pollutant can be transported from for a longer distance also. Simple example I will tell you, dust storm that happens in the southwestern countries, South Asian countries, southwest country, Asian countries, that will reflect somewhere in India also. Dust storm, if there is something happens somewhere in southwest Asian countries, we get the impact even in India also. For example, mercury emissions also will be there in the environment for longer duration, and also it will be transported from for a longer distance also, depending upon the climatic conditions. Therefore, we call such pollutants as persistent organic pollutants. Yeah, understood, please, or any doubt? Any questions? Yeah, are you people there? Nobody responding, I don't know.
No question, sir.
Yes, sir.
No
Good,
questions.
sir.
Okay. Therefore, persistent organic pollutants are organic chemical substances, carbon based, of course, possess a particular combination of physical and chemical properties such that they remain intact for exceptionally long periods of time, many years it will be there in the environment, and are toxic to both humans and wildlife, and also they can be transported for a longer distance also in this period. Therefore, they are called as persistent organic pollutants. Now, in order to control these persistent organic pollutants, like pesticides, all pesticides, they are persistent organic pollutants. There are so many items have been banned by the government of India also, like DDT and other things have been banned. So for example, global treaty to protect human health. This is the Stockholm Convention is a global treaty to protect human health and the environment from the chemicals that remain intact in the environment for longer time. That is what we call it as persistent organic pollutants. And it adopted by the parties on 22nd May 2001 in Stockholm, Sweden, and came into force with effect from 17 May 2004. And 181 countries have signed and ratified. And under the Stockholm Convention, there is a category called under Annex A category. And to this convention, Annex A to the convention, they are meant only to eliminate the production and use of all the chemicals. And specific agents are there in Annex A to the items, and apply only to the parties that have registered for their permitted and permitted for import and export with the specific restrictive conditions. Somebody wants to import from one country to us, let us say India wants to import from some sort of pesticides which are not manufactured in this country, then under specific conditions, that sort of import is permitted. Only the list, whatever the chemical that are listed under Annex A only. Others cannot be imported at all. Item B, Annex B items are there. They restrict production and use as well as import export. Means neither you can go for production or use as well as import export. Therefore, best example is the DDT. There has been a banned item. This pesticide cannot be used. Neither it can be manufactured. And apart from this, endosulfan. Endosulfan is also one of the items which has been banned for manufacturing and also its use because it is a persistent organic pollutant. Therefore, endosulfan gases are not at all preferred. Therefore, the production also has been banned. Therefore, Annex B items are all, they restrict production and use as well as import export. Whereas in Annex A items, some chemicals they permit to import export under specific conditions only, depending upon the use. Reduce or eliminate release of unintentionally produced persistent organic. Like yesterday I was talking about the dioxin furans, polychlorinated dibenzodioxins, and PCDF, polychlorinated dibenzofurans. These are the pollutants that will be emitted in the incineration process if you are not adopted the operating the incineration process as specified under the specified temperatures, and also if you are not in a position to reduce the temperature in a fraction of a second from 1050 degrees centigrade to less than 450, in such a case, reoccurrence of this polychlorinated dibenzodioxins and polychlorinated dibenzofurans also will be generated. They are highly carcinogenic in nature. They are persistent pollutant, persistent organic pollutant. Apart from this, hexachlorobenzene, hexachlorobutadiene, and polychlorinated biphenyls. Please kindly remember these things, names: hexachlorobenzene, hexachlorobutadiene, and polychlorinated biphenyls, polychlorinated dibenzodioxins, and polychlorinated dibenzofurans. They are all persistent organic pollutants. They will be in the atmosphere for longer time, and they also will be transported to longer distance depending upon the climatic conditions. And the Stockholm Convention promotes use of best available technology to control release of persistent organic pollutants and also ensures stockpiles are managed safely. Now we have got somewhere in Kerala, we got some stockpiles of banned item, the pesticide like endosulfan. Endosulfan items we have found they are stockpiled, they are not in a point to dispose of. Now we are trying to come out with a disposal option. We have analyzed, examined. This is the banned item, they can't use it also, therefore it has to be disposed of by adopting environmentally sound technology only. Implementation plan for control of is there. Every country is having action plans for control of persistent organic pollutants, emissions or discharges or production and use. India signed the Stockholm Convention in May 2002, ratified in 2006, and we have a national implementation plan has been prepared under implementation. As a part of that, we have come out with various rules, hazardous management rules, import-export restrictions are there. We also come out with the biomedical rules wherein the mercury parameter has been prescribed under the rules. That limit has been prescribed as 0.005 milligram per nanometer cube for liquid waste management. Similarly, we have got emission norms also were there. I have 0.01 something. And also in case of dioxin it should not be more than 0.1 nanogram toxic equivalent per nanometer cube. Therefore, we are also the given specifications, the standards for the various emission standards for persistent organic pollutants also. Now we are in the process of implementation of all the action plan what we are committed under the Stockholm Convention. Of course, even norms for dioxin have been prescribed for various the incinerators, which includes biomedical incinerator that we have seen about 0.1 nanogram toxic equivalent per nanometer cube is the limit. Now coming to the Minamata Convention. Minamata Convention is relating to mercury poisoning at Minamata in 1956, and this is a globally negotiated international treaty that addresses global mercury pollution and its serious health damage. It is an international treaty and adopted and open for signatures on 10th October 2013 and entered into force on 16th August 2017 at a place at the same place, Minamata only. It happened on 2017 at Minamata only. The government officials also participated. Signed by 144 countries and ratified by more than 88 countries. And India signed this the Minamata Convention on 30th September 2014 and ratified in 2018. Though it is we have adopted this, though it is open for signature in 2013, we could go for signature. India signed this convention only on 30th September 2014 because we have got our own commitments. We have got our own the demands. We should be able to meet the demands, and also we have to find the alternate the materials to the mercury-based instruments. Then only you can go. Therefore, after ensuring that we can go for the mercury-free the items, then only we have gone for the signing of the Minamata Convention. For the best example is the mercury-based thermometers. Mercury-based beavers have been banned, but once again lifted the restriction. But as far as possible, we have taken not as a ban, but we are suggesting not to use the mercury-based instruments like thermometers and BP apparatus. Now, most of the hospitals have phased out the mercury-based instruments and they are gone for digital thermometers and digital BP apparatus. Phase out, the main purpose is phase out mercury use in number of processes and control measures to release on environment. Of course, we have already given standards for various incinerators and as well as the liquid waste management generated from the hospitals also. And waste in interim storage and its safe disposal. In case if any stockpiles are there, that has to be stored properly and it has to be disposed safely. Addresses sites contaminated with mercury and health issues. There are some contaminated sites in this country, somewhere in Kodaikanal in Tamil Nadu, and some 1 or 2 sites somewhere in Uttar Pradesh and Odisha. There are some contaminated sites which are contaminated with mercury, and action is being taken for remediation of these contaminated sites in line with the Minamata Convention. This is about the conventions. Any doubts, please, or any questions? These are the conventions. Therefore, you have to remember what to convention for what purpose. You have to remember that's all. Therefore, we are seeing today. We'll recollect. We have gone through the 4 conventions. One is relating to the Montreal Protocol. This is in order to regulate the use of ozone depleting substances. Whereas Basel Convention, it is mainly to control or to regulate transboundary movement of hazardous waste. Whereas the Stockholm Convention on persistent organic in order to regulate production and use of persistent organic pollutants like pesticides and all. Minamata Convention is on mercury only. It is specifically to mercury management and production and use of, we have to phase out production use of mercury-based things, items, and also we have to take necessary measures for control of mercury waste management in line with the Minamata Convention. Any questions, please?
No, sir. No, sir.
No. Okay, I will tell you one question. I just want to ask you, these are some sort of instruments where they are mercury-based instruments which are commonly used in the healthcare facilities, like thermometers, sphygmomanometers, dental amalgam, esophageal dilators, and just 1 minute, please. I got one call from ministry. Let me answer to that call. Okay. No, you send official letter with the samples, no problem. Okay. 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 Therefore, these are the instruments where mercury-based instruments we used to use, like X-ray machines, button cells, medical batteries, thermosol laboratory chemicals, electrical equipment, fluorescent lamps containing then cleaning solutions, etc. They used to have some sort of the mercury-based things. How we used to dispose of this the mercury-based instruments? Anybody can having idea, please? Anybody can say how to dispose of mercury-based? If suppose you are using a mercury-based instrument, if there is a thermometer breakage, how to dispose of? Anybody can say, please? How to collect them? Yeah, I will have a quick glance. I want to give you a very quick glance. The mercury is a chemical form. Okay, it is the only heavy metal available in the liquid form and easy. It can volatile in room temperature easily, and it is a persistent organic pollutant. It will be there in the environment for longer duration, longer. It can go for longer time also, and there will be, if in case there will be bioaccumulation may happen. If there is a rainfall, the mercury which is there in the vapor form will strip off through liquid, then it will come and join the water body, and it will come through the food chain. For the fish and all, when you start eating, which we are collected from the lake where there is a contamination of mercury and all, the mercury will come through the food chain. It may cause problem, toxicity, all the things. There are three forms of the elemental mercury. I told you, it is the only liquid metal, inorganic in nature, mercury chloride and mercury sulfide. And whereas in organic form, it will be in methyl, ethyl, diethyl mercury, and polyethyl organic groups. And methyl mercury is the most toxic in nature, and it will be converted under various favorable conditions in the form of bacterial actions. Voltage happens at room temperature definitely, and it will come and join into the food chain because of rainfall. Any emissions are there which are there in vapor form into the atmosphere. When there is a rainfall, all this mercury will come into the water bodies. They join water bodies. Then the water generally will have fish that once if we take the fish, it contaminates our toxic. It may be toxic to the humankind also. Therefore, it reaches food chain easily, though it is a persistent organ pollutant. Biomagnification also takes place. Means it reaches through the food chain system. And health effects are there. Acute exposure to high levels of elemental mercury may cause tremors, slowed motor nerve functions, and memory loss. And acute inhalation of high amounts of elemental mercury may cause chest pains, acute renal failure, shortness of breath. Acute ingestion of inorganic mercury may cause nausea, vomiting, abdominal pains, and chronic exposure to inorganic mercury may cause kidney damage also. Therefore, you can see, you might have seen chronic exposure to elemental mercury. Classic symptoms of the Madhata syndrome is the one syndrome, and lot of problems were there. Therefore, because of considering the impact of this the mercury, we have eliminated the mercury in various uses. Health effects, I already told you, the effects of organic forms of mercury is very toxic nature. Organic forms of mercury in different forms may be methyl, ethyl, diethyl, and phenyl organic groups. And methyl mercury is very highly toxic in nature, absorbed by the body 6 times more easily than inorganic mercury, crosses the placenta and concentrates in the central nervous system also. That causes health impacts like this. Therefore, mercury poisoning is known to us, and we have seen in the Minamata when there was a discharge of mercury at a place called the Minamata. Therefore, we are familiar with all this Minamata convention. This is some the picture the child who suffered because of the mercury emissions at Minamata. But these are the conventions. Just to give introduction only. If you want to go into detail further, you can go through the various conventions so that you will come to know about the conventions. Any questions? If no questions, we'll move to other topic, that is on what are the various rules and regulations which are there in various countries, and especially in the SEAR countries, Southeast Asian region countries. You all know that India has come out with the biometric rules. We have got biometric rules are there since 1988, and further these rules were replaced with the new rules called biometric-based management and handling rules, the biometric-based management rules 2016 onwards. Of course, this is the evaluation of various rules in the country. Since 1974 onwards, we got various rules are there. That is what 1974 Water Act, Air Act. So many rules have been notified, and most of the rules now notified are under the Environmental Protection Act, like noise regulations, battery management rules, EA notification. Then the biometric-based rules in the year 2016. Therefore, various rules are there, and the systems are there in place in the country. And if you want, you can refer to these rules. I am not going to refer once again about these rules, because already I told about you about the biometric rules in the country. I think we are dealt in detail. Then no necessity to talk about once again the biometric rules in this country. I think responsibilities are there. Various responsibilities have been given to the ministry. The ministry, the Environment, Ministry of Environment, Forest and Climate Change, the main ministry for making policies concerning the biometric management in the country, providing financial assistance for training and awareness program, and facilities for financial assistance for setting up of facilities, undertake or support operation research and assessment with reference to the risk to environment and health due to biometric waste. These are various responsibilities given under the rules. Similarly, to other organizations like Health Department is also there, Ministry of Health. There is a the responses have been given under the biometric rules 2016 in the country, and which includes grant of license to healthcare facilities, nursing homes or veterinary establishments with the condition to obtain authorization from the state board, mounting, refusal or cancellation of license for healthcare facilities. That is under the control of health departments, publication list of registered healthcare facilities, and so on. Like this, there are some responsibilities given to various departments. Similarly, we have been given responsibility to CPCB also. And as per the responsibility given under the rules, CPCB has to come out with the various guidelines for biometric waste management, and we have to coordinate with the state political boards, and we have to conduct training courses for authorities dealing with the management of biometric waste, and we have to lay down standards for new technologies. That is our role. Lay down criteria for establishing a common facility and random inspection of monitoring of healthcare facilities, common facilities that we have to do. That we will be doing as a routine life. And also review with state boards regarding the implementation of the biometric waste rules. The inspection monitoring of healthcare facilities other than biometric, the medical inspections like rooms, sick bays on the board ships, etc., lies with the CPCB only. Undertake or support research or operation research regarding biometric waste, we can take these other responsibilities. Similarly, responsibilities are given to Ministry of Defense, and the state boards are there, state governments are there. These are the responsibilities given under the various acts. Of course, monitoring mechanism is there at central level. Ministry of Environment Forest, they review once in a year a state political board, state health department, and advisory committee at the state governments. Whereas at the district level, we have got district level monitoring committees of the state government or UT administration at various states. At state level, I told you, advisory committee is there, and at the district level, we have got district level monitoring committees. For at central level, we have got Ministry of Environment Forest, CPCB, and the state governments are there. Of course, I don't want to repeat once again. Coming to legislation in Bangladesh, in the biometric based.
Sorry, sir.
Yeah.
Slides are not visible, sir.
Oh. As far as the biometric rules in India is concerned, we have dealt in depth, and you are aware of this rules part is concerned. I don't want to repeat once again. But let me see what are the various rules in other part of the world, like other countries like Bangladesh. In Bangladesh, the medical waste management and processing rules 2008, they are promulgated by the government of Bangladesh, and these rules mandate segregation of medical or hospital waste at source as per 6 color coded bins, whereas in our country only 4 color coded bins. Specifications for containers label to be used and provision of temporary storage has been prescribed by under these rules. And also there are suggested standards for operation of treatment equipment for treatment of industrial waste before disposal, and separate collection, transportation, final treatment and disposal by city, corporations and municipalities have been prescribed. There are some national guidelines for medical waste management revised in 2016. That is concerning the bomb waste rules management in the country, like the Bangladesh. Whereas in the regulatory mechanism is there, it conformably to the medical waste management and the process rules 2008, the government of Bangladesh had identified prescribed authority for granting authorization and for implementing the rules. And also, the prescribed authority or committee may comprise apprentices of various departments like Department of Environment, Power Sevas, so that is their municipal corporations and municipalities, and development authorities, and Directorate General of Health Services, Bangladesh Medical Association, and NGOs. They will try to look into the regulate the management of waste in the country, and they try to review the various waste management aspects relating to bomb waste in Bangladesh. Coming to Bhutan is concerned, in Bhutan, no separate legislations are there, but they covered under Water Prevention and Management Act 2009, the Waste Prevention and Management Regulations. They are covered under these particular rules. They don't know separate rules for bomb waste management in Bhutan. First edition of Infection Control and Healthcare Waste Management Guidelines developed in 1994, and the fourth revision was done in 2014. Medical waste, mainly 8 categories as infectious, hazardous, sharps, pharmaceutical, chemical, pathological, heavy metals, and general waste. Waste are segregated using color-coded bins and transported to the treatment site in designated trolleys. Main treatment options followed are autoclaving and chemical disinfection only. They don't have the incineration facility. They are adopted only autoclaving and chemical disinfection is the only method they followed. Regulatory mechanism in the Bhutan is waste prevention management regulations are there. I told you 2012, under which they manage this environmental waste also. They got National Environmental Commission, which is designated as the apex body for responsible for coordinating and overseeing the implementation of the Act. Under the regulation, the National Environmental Commission is responsible for monitoring the compliance performance of the implementing agencies. The regulation stipulates that the implementing agencies shall be the health clinics, Ministry of Health, Ministry of Agriculture and Forests, and the hospitals, Department of Livestock, Bhutan Narcotic Control Agency, and the Drug Regulatory Agency. They are the authorities for overall enforcement of the bomb waste management in the state of in the country Bhutan. Legislation in Indonesia is concerned. Health Minister Decree number 1204/24 on hospital environment health requirement. Ministry of Environment and Forest Regulation number P65 year 2015 are the technical guidelines and requirement of health the hazardous healthcare waste management. Government regulations number 6 issued in 2013 requires all hospitals to be assessed with a rating system ranging from black to gold, black, red, blue, green, and gold, depending upon the management that they are doing. Blue is implementation of environmental management efforts are in accordance with the rules. Therefore, they categorize as blue. Black means no efforts taken to manage healthcare waste. Red means environmental management efforts are not implemented in accordance to the rules. And green and gold indicates beyond criteria or compliance is more than what is required. Therefore, they categorize into the hospitals which are complying or not, depending upon the compliance status, they categorize into blue, red, black, green, and gold. In case any violations are there, according to Article 41 of the Law number 23 of 1997 on the environment, those damaging the environment can receive a maximum sentence of 10 years in jail and a maximum fine of around $60 to 40. In case of Indonesia rupiah, it is about 500 billion in the local currency. However, if the damage leads to death, the maximum sentence in jail is about 15 years, of course, and now enhanced fine also they are living. Agency is responsible for dealing with the hazardous and environmental waste management in Indonesia is Ministry of Environment, Ministry of Health, and local authorities in Indonesia. These are nowhere we got the rules, direct rules, like in India. Nepal, they don't have any rules. The Solid Waste Management Act 2011 itself will take care of the waste management, includes the healthcare waste. The healthcare waste management guidelines 2014 provides the minimum standard for healthcare facilities It focuses on safe and proper techniques for segregation, collection, transportation, storage, and treatment and disposal. It supports for non-burn and green technology only. Both in Bhutan, Nepal, they adopt non-burn technologies depending upon the climatic conditions. Because of cold countries, cold places, they cannot go for incineration because of it requires the continuous operation of incineration. Because in order to maintain desert temperature, in that cold conditions, is very difficult sometimes. National immunizations injection safety policy is there, mandate the use of auto disposable syringes in immunization program. That is the only thing is there in Nepal. Of course, regulatory mechanism is there like in every country. They got the various institutions who are responsible for the enforcement of the rules. There is the Department of Environment. Apart from that, Ministry of Health, Ministry of Population and Environment, Ministry of Local Development, Municipality of Kathmandu, Nepal National Health Research Council, Royal Nepal Academy of Science and Technology, non-governmental organizations. They are responsible for enforcement of the waste management, healthcare waste management in Nepal. Coming to Sri Lanka also, all these countries, neighboring countries, they're all coming up with the new rules now. I think so. United Nations, UNDP, they are trying to help Nepal, all South Asian countries, Sri Lanka, Bhutan, Bangladesh, and all, to come out with the necessary rules for waste management, like in India. I think in case of Sri Lanka also, no rules, separate rules. National Environment Act of 1980, with its amendment number 56 of 1988 and amendment number 53 of 2000 are the basic legal documents that regulate the hazardous waste and consequently the hazardous healthcare waste management in Sri Lanka. Biomedical waste management is a legal requirement under the legislation of Central Environment Authority effective from 1st February 2008 onwards. They got the national policy on healthcare waste management provides guidance. Of course, that has been copied from UNDP. They got the color code system, waste transport system has to be adopted as per these guidelines. Treatment disposal of waste from healthcare facilities they insist as per these guidelines. Wastewater treatment followed by occupational safety of the healthcare waste. These are all about the countries which are having the various legislation for waste management. Even Thailand waste generates during medical diagnosis or disease, immunization experiments, autopsy or examination of animal carcass, including in research, are defined as infectious waste. They are defined infectious waste in their own way. This is how they are defined. Waste management system is similar to other countries where waste is segregated at the source using color-coded bins, then transported in separate trolleys to dedicated waste storage rooms, and then sent to various offsite. Offsite means away from the hospitals. Is only permitted for disposal of the healthcare waste. At the central government level, the agencies that play a key role in ensuring proper waste management in Thailand are Department of Environmental Quality Promotion, the Pollution Control Department, prescribes guidelines, of course, Department of Health, Ministry of Public Health, the local administration organizations, they are responsible for overall enforcement of the rules in the Thailand. And one more country is there, Maldives. There also any separate rules are not there. And most of the countries, neighboring countries, they don't have any rules. Therefore, they don't necessary to, I don't think so, they don't necessary to discuss further about all these neighboring countries. What I want to say is, nature-based management authorities should be there, apart from regulations. Therefore, frame relevant rules by issuing of gazettes, rules or documents. That is what we feel, that there should be proper regulations for the healthcare waste management, and also they have to develop and maintain awareness programs to oversee and monitor periodically the implementation of the laid down policies and rules. There should be a system covering all these things. To have powers for issuing instructions, initiate the punitive or legal actions against defaulters, to have separate budgetary allocation should be there to ensure compliance to the notified regulations. To have a separate research and developing wing for developing innovative approaches, ideas, and appropriate technologies for management of healthcare waste management. Therefore, there should be a nation-based management authority should be there at each and every country. Of course, we have got our own regulatory authorities at state level, at district level, at central level. They are enforcing all the regulations. Similarly, in all the countries there should be a nation-based management authority. They should be able to come out with all these the solutions for waste management, so that the healthcare waste generated from hospitals can be managed safely without any problems. We have seen the various rules and regulations in SEAR countries. In India, we got Biomedical Waste Rules 2016, and we have learned very in detail about these rules is concerned. They don't need to explain by me. We got regulatory mechanism, whereas ministry is responsible for enforcement of rules. In SEAR countries, nowhere, only except in Bangladesh, they simply copied our 1998 rules into their own language, and they have in Urdu, they have notified. That I saw. It is as same as 1998 rules only of notified the government of India. They copied, but there's no infrastructure. If you take either Bangladesh, Bhutan, or Indonesia, or Malaysia, or Myanmar, or Nepal, or Sri Lanka, especially these poor countries like Sri Lanka, Nepal, Bangladesh, Maldives, Bhutan, and they don't have any system for management of healthcare waste. Definitely. Coming to the regulatory mechanism in SEAR countries, in India we have got regulatory mechanism. We have got the Ministry of Environment, Forest, Ministry of Family Health, Health and Family Welfare. We got Director General Armed Forces Medical Services. State governments are responsible. CPCB is responsible at the national level. State Pollution Control Board are in the states, and pollution control committees in the respective UT are responsible for enforcement of the rules. Whereas government, in case of any violations, action can be taken by the regulatory authorities as per the rules. Similarly, in case of Bangladesh, the prescribed authority will have representation of Department of Environment, the Power Service, Development Authorities, and this. Whereas in case of Bhutan, National Environmental Commission responsible to monitor compliance performance. Authority responses are the Ministry of Health, Ministry of Agriculture and Forest, associated institutions, Drug Regulatory Authority, Bhutan Narcotic Control Authority. They are responsible regulatory authorities in case of Bhutan. Similarly, in Indonesia, we have seen agencies dealing with hazardous and biometric waste are responsible, or mainly they are Ministry of Environment, Ministry of Health, or local authority. In Nepal, the acts relevant healthcare waste management are Ministry of and the regulatory authorities are Ministry of Health, Ministry of Population and Environment, Ministry of Local Development, Ministry of Kathmandu, Nepal. These other organizations are including NGOs. In Sri Lanka, authorities responsible for enforcement of the healthcare waste management is the Central Enforcement Agency, Ministry of Health. Similarly, in Thailand, Department of Environment, Quality Promotion, Pollution Control Committee, and local administrative organizations are responsible for overall enforcement of the rules. This is about the various countries followed and all, the waste management in healthcare waste management regulations and regulatory mechanism, and the monitoring and quality assessment healthcare facilities. In the country like India, we have got advisory committee at the state level. This advisory committee will review enforcement of the rules at the state level. Apart from the state level advisory committee, we have the district level monitoring committee. They review and verify the compliance to the rules by the COM facilities and the healthcare facilities. At the central level, we have Ministry of Environment, Forest and Climate Change. CPCB is there. At the state level, we have got the regulatory authorities at the state level. We have state control boards in the states and the pollution control committee in the union territory. This is about the topic assigned to me. I hope so I have made justice to you all. Still, if you feel, if you have any questions, you can talk to me. I think so. I have made my best. Whatever the best I can do, I have done it. Still, if you are having any questions or any queries, you can talk to me on my mobile number, or you can communicate me by email at jcb.cpcb@nic.in. This is about the international protocols which are there, and also what are the various regulatory mechanism or the rules and followed in different countries of Southeast Asian region countries. This is about the topics assigned to me, and we'll have a break for 10 minutes. Afterwards, we'll come back. We'll try to have some sort of the objective type of questions and questions. We'll try to understand what is the answers also, please, if you all agree. Any questions? Any questions on today's topic? Any questions, please?
No, sir.
Okay. Then we'll have a break for 10 minutes. I think so. We'll come at 5:10 if you all agree. Around 5:10. Is it okay? You can have tea, then we'll come. You can join back, please. Don't leave. We are going to see all the objective type, covering other aspects also which I have not covered. Because I cannot separate out whatever I have prepared. Therefore, I will try to have a look at it. Then let us see what best can be done by us. Okay. We'll come back at 5:10, please. We'll meet at 5:10. Okay?
Okay, sir.
Please. Okay then. Yeah, good evening to everybody. Am I audible to you?
Yes, sir.
Yes, sir.
Yeah. Now, all of you kindly switch on your the cameras, please.
Sir, good
This
evening.
is like interest. I don't know if you are comfortable. Can switch on your camera. Otherwise, if you are not comfortable, there no restriction for me that you have to switch on your camera. If you are comfortable, you can switch on your camera. Now, this is the some questionnaire. We'll have a look at it. Okay, just to try to, if you know the answer, you try to answer. Otherwise, if you don't know the answer, we'll discuss. We can answer it. Let us start. All are there. I hope so. All of you have come back. All are there. Yeah. All are there. Still, people have to come and join.
Yes, sir.
Yeah. Okay. Yes. Okay. We'll have a look at it. How many types of color-coded biometric waste categories are there defined under biometric waste rules? Anybody can answer?
Sir, the question paper is not visible, sir.
It's not visible. Okay. Okay.
4 types.
Yeah. 4 types. Yeah. Can you see?
No, sir.
Huh? No, it is shade.
Yes, sir. Is it visible?
Yes, sir. Now it is visible.
Others?
Yes,
Visible,
sir.
you know? Okay.
Yeah,
How
visible.
many types of color-coded biometric waste categories are defined under biometric waste rules? How many
4.
color-coded?
4 types.
4
4
categories.
types, sir.
Okay, then. As per waste management hierarchy, which is the least preferred option? As per waste management, if you want, I can increase the percentage rate. Percentage, I think so. So that I can read comfortably. Is it
Yes, sir.
comfortable?
Yes, yes. Yeah, is it comfortable?
Now, now, as per waste management hierarchy, which is the least preferred option?
Disposal on land, sir.
I'll call you back.
One
Therefore,
type, sir.
at which place the rules prefers segregation of waste? At which place?
At the source of
B.
generation.
B at the source of generation.
என்னாச்சு நந்தி? ஏன் நீ அடிச்சுட்டே இருக்க அவ?
Shops.
Powering off. Power on. Your device is ready to pair. You are
Yeah, are you there or not? Please, can you see the questions?
Yes, sir.
Okay. Can you please tell me What is the safest treatment option for treatment of plastic waste? Which is the safest treatment option for treatment of plastic waste from hospitals?
Shredding, sir. Autoclave,
Before
microwave,
that,
followed by
autoclave, microwave, followed by shredding is the safest method of treatment of plastic waste from hospitals. Mercury waste generated from healthcare waste can be categorized as what waste? What type of waste is it?
hazardous.
Hazardous waste.
Yes, it is like a hazardous waste. Under National Health Mission, what are the norms set by Government of India for setting up of public health centers? I think this I did in my first slide in my first class. That the norms are there.
One per
For
5,000.
under National Health Mission,
1 in 3,000 population.
30,000 population.
30,000.
I mean, yeah, for public health center, PSC, for public health centers, the population should be at least 1 in 30,000 population. Under National Health Mission, what are norms set by Government of India for setting up of community health centers? For community health centers, the population should be 1 in 80,000.
30,000.
1 in 80,000.
Okay, under Bambeck waste rules, healthcare facility is required to be disposed of. Through the common facility located in what distance? 75.
75 kilometers.
Who is the prescribing authority in the state as per rules? In the
State,
state, who is the prescribing
State
authority?
Pollution Control.
Yeah. Under which provision of the Environment Protection Act, action can be taken against the violators? Maybe a hospital or facility. Under which sections they can take actions?
Section 5 and Section 15.
Section 5 and
2.
Section 15 of the
15.
Very good. Bambeck waste rules are applicable to whom?
All persons.
All persons. Who are they?
To
Generate.
generate, collect,
collect,
store, transport, dispose or involve.
Yes. How do you define Bambeck waste?
Dirts.
Generated from nozzle.
Diagnosis.
I told you one word. What is that word you have to remember to define Bambeck
Dirt.
waste?
Dirt.
Dirts. Okay, dirts. DIRTS. You remember that word? You will define Bambeck waste definitely on your own. How many color-coded categories of Bambeck waste are defined under Bambeck waste rules? The question is repeated.
4.
How many color-coded categories are there?
4
Four
number of categories.
Yeah. Name the suitable equipment used for on-site or intramural transportation of waste. What type of the vehicle can be used for within the hospitals?
Closed and labeled.
Closed, labeled
Wheelbarrow or trolley. Yes. Bambeck waste such as untreated human and ornamental waste and infection solid waste and biotechnology waste cannot be stored beyond how many hours?
70.
48 hours.
48.
48 hours. Because we can't store more than 48 hours. These untreated human ornamental waste, animal waste, and soil waste and biotechnology waste cannot be stored more than 48 hours. Then, which form is required to be submitted to obtain authorization from the State Procurement Board? If you want to
Form
get authorization, Form 2. Yes, answer is B. For the time period by which the authorization under the Bambeck waste rules is required to be granted by the State Procurement Board in the states, by what time they have to grant authorization? When application is
Within 90
complete,
days.
within 90 days. The answer is okay. What is the time limit for submission of annual report by the hospital? By what time they have to submit annual report?
June 30, sir.
30 every year.
June,
June 30.
June
Okay,
30th
as per WHO,
of every year.
as per WHO report, 2014 report, safe management of waste from healthcare facilities. What is the percentage of initial waste in total waste generation in healthcare facility?
Around
What is the percentage of
20%.
infectious waste? 20%. Yes.
20%.
What type of healthcare waste is potentially infectious to healthcare workers?
Sharp
sir,
waste.
basically
Waste
sharp
shops. Waste shops. And infectious
C.
laboratory waste.
Infectious
What is the
laboratory waste.
name
Cholera
the
is a-
waterborne disease from the following?
Cholera.
Which is the waterborne disease? Anybody can say, please?
Cholera.
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 Cholera is the waterborne disease, therefore which you can expect. Then what type of what type of Bambeck waste requires pre-treatment as per rules?
Lab waste, microbiology waste,
Laboratory waste,
Lab-
microbiology waste, blood samples and
Laboratory
blood
waste,
bags,
microbiology waste, blood samples
They
and
require?
blood
pre-treatment. Yes.
bags.
For how many days HIV can survive at ambient temperature?
3 to 7 days.
3 to 7 days. C.
So this I have not dealt. This may be from other the chapters. Which is the faculty, the faulty option for hazardous nature of the chemical waste? Which is not relevant to hazardous nature of the chemical waste? Which is not relevant?
Explosives, sir.
No, explosives is the hazardous nature.
Infectious.
Hazardous. Infectious. It is infectious waste is related to infectious nature is related to biomaterial waste only, hospital waste, healthcare waste. Name the hazardous toxic chemical used in medical equipment for diagnosis, like blood pressure. What type of hazardous chemical is used for
Mercury, sir.
the operators? Mercury. We all know. Yes. Up to what time records pertaining to biometric waste generation and operation treatment equipment is required to be stored by the hospitals? For how many months or how many years you have to store the records?
5 years.
5 years.
5 years or 60 months or 5 years. What the time period by which you can make appeal? Appeal made within 30 days should be disposed of by the appellate authority. In case you have made appeal under the rules by submitting the application form 5, then that
90.
application has to be disposed of within how many days by the appellate authority?
90 days.
90 days. By 90 days, they have to dispose of the thing. In which year biometric waste rules were promulgated by the government of Bangladesh?
2008.
2008. Nepal, which regulations regulates the healthcare waste management? We don't have separate regulations, but in Nepal, Solid Waste Management Act 2011 will regulate the healthcare waste management. On what day biometric waste management rules 1998 were notified by the then Ministry of Environment and Forest under the Environment Protection Act? Earlier, there were rules in the year 1998. What is the date of notification of 1998? Rules is 27 July 1998 is the correct answer. Which pollution control board is only empowered for monitoring of armed forces healthcare establishments for army hospitals under Ministry of Defence? Which board can go and inspect?
Central Board.
Central
Pollution Board only. They will not fall under the purview of State Pollution Board. States cannot go. Under the Biometric Waste Management Rules 2016, who is responsible for constitution of State Advisory Committee at the state level?
State
government.
State government. Yes. State government in the state or the Union Territory Administration in the UT, they are responsible for constitution of the advisory committee at the state level. In case of state advisory committee, the state government, whereas in UTs, UT administration is responsible for constitution of the advisory committees. These are some of the questions I just want to share with you. Kindly bear with me. One more, let us see one more the questions. It may not be in the correct order. I hope so. Kindly bear with me. I was trying to. They are very old. I prepared long time back. They are not compatible with this present computer. So there are some disturbances there. Kindly bear with me. What are the main objective and functions of Hospital Infection Control Committee? I am telling you this. I have not dealt, but somebody would have dealt. What are the main functions of Hospital Infection Control Committee? Developing and implementing infection control programs in the hospital.
Programs in hospital.
Yeah, who is the chairman of the Hospital Infection Control Committee?
Senior administrator or the director.
Senior administrator.
Yeah. Hospital Infection Control Team constituted by the healthcare facility to coordinate and implement all infection control activities on your day-to-day comprises mainly whom? Comprises mainly
Control officer.
control officer. Yes. As per biometric waste rules, which hospital is required to constitute a biometric waste management committee?
More than 30 beds, sir.
Yes, 30 and more bedded hospitals, they have to constitute the biometric waste management committee. If number of beds are less than 30, then what they have to do? They have to designate one nodal officer for management of hospital waste. Name an infection which may occur likely due to droplet transmission. Somebody would have dealt, I have not dealt this. Influenza and SARS. Name a vector transmission disease to the general public. What is the vector transmission disease to the general public? Dengue and malaria. Okay. In which form occupier or operator has to submit annual report annually by 30th June? Form 4. Yes. Any infection occurring after 48 hours is considered as what?
Nosocomial infections, sir. All health acquired.
Healthcare associated infection.
Healthcare associated infection. When hands are not visibly soiled and healthcare waste to patients is necessary, then which is the preferred method of hand hygiene?
Sanitization, sir.
Alcohol gel.
Alcohol gel can be used, okay? Alcohol gel can be used so that it is immediately you can sterilize and you can use it. Which is the preferred method of surgical hand disinfection? Preferred method of surgical hand disinfection. Antibacterial soap and
Antibacterial soap.
alkali solutions. What is the expected efficacy in when chemical disinfection is used using 1 to 2% hypochlorite solution? What is the efficacy of chemical disinfection method?
4 log.
4 log 10. Yes, fantastic, good. Which is the most safe and economical way of treatment and disposal of biometric waste generated from a hospital? Which is the most economical way of treatment and disposal of biometric waste generated from a hospital? Within the hospital, is it correct? No, it is not economically viable. Where the waste is generated, is it correct? No. Through common biometric waste treatment facility, is it correct?
Yes, sir.
Common biomedical
Through
waste.
common biomedical waste.
Because cost of treatment will be less if waste is treated through common biometric waste treatment facility, and we can also ensure compliance to the rules. Up to what period records pertaining to operation of incinerator, autoclave, or microwave is required to be maintained by the hospitals or complex operator?
5 years.
60
5
months
years.
or 5 years.
Yeah. As per EA notification, common biomedical waste facility requires EC, environmental clearance, from state environmental impact assessment authority or ministry. Under which category? As per environmental EA notification, under which category common biomedical waste facility is covered? I think this aspect might have been told by somebody, not by me. Somebody might have covered. I don't know whether they covered or not, but this is under 7DA category. Common biomedical waste requires environmental clearance from state environmental impact assessment authority or MYF, depending upon the type of the facility. Okay. Which is the minimum land area required for development of common facility? How much land is required for development of common facility?
0.5 acre.
At least half acres is required for development of a common facility. Answer is B. Somebody would have taught you, not by me. Which is the preferred best burning technology for treatment of biometric waste? Which is the best method? Yesterday we have seen conventional the open burning method, incineration, and plasma pyrolysis, and autoclave also. Autoclave is only for non-infectious waste like plastic and other things. Whereas the open burning is a banned item. Now we got two choices. One is incineration, plasma pyrolysis. Among these two, which is the best one? Plasma, because using plasma torch, we can generate about 5,000 degrees temperature, about 5,000 degrees centigrade. We can distract all sort of waste easily. Therefore, plasma pyrolysis is the best technology, but costly. But it is a costly affair. What is the emission standard limit prescribed for dioxin furans in case of emissions for incinerators? I told you, this limit has been prescribed under persistent organic pollutants also. Answer is B. 0.0. It is 0.1 nanogram toxic equivalent per non-mole material. Kindly remember these things. Definitely you can expect. Which is the emission standard limit prescribed for mercury and its compounds for incinerator and the biometric waste rules?
0.05 mg.
Yeah, that is correct. Then, which is the prescribed temperature limits for primary and secondary chambers of incineration and the biometric waste rules? Which is the time limit, the temperature suggested in the rules?
800 to 1000.
The 800 degrees centigrade and 1050.
Yeah, 800 and 1050 minus plus or minus 50 is the temperature suggested in the rules. D is the answer correct. What is the prescribed minimum residence time for secondary chamber in case of incineration? What should be the minimum time, residence time in the secondary chamber?
2 seconds.
How much?
2 seconds. 2 seconds.
2 seconds. Therefore, at least 2 seconds should be there for ensuring proper combustion in the secondary chamber of incinerator. There should be 2 seconds should be there. Otherwise, combustion may not happen. Okay. Okay. Then. What is the prescribed minimum stack height for incineration? Under rules, what is the minimum stack height suggested under the rules?
50 meters.
50, are you sure?
No.
30 meters is the suggested stack height for incineration facility as per rules, biometric waste rules section. Okay. Now, biometric waste to be incinerated shall not be chemically treated with as per biometric rules. What type of biometric cannot be incinerated? Waste to be incinerated shall not be chemically treated. Any waste cannot be treated chemically, which is going for incineration. With what chemical we cannot treat?
Chlorine.
Chlorine-based compounds we cannot use that for treatment of waste because the chlorinated, the treated waste, if you go for incineration, they are going to cause dioxin furans definitely in the incineration process. That's why chlorinated waste cannot be treated. Waste cannot be incinerated. What type of incinerator is preferred among the following incinerators?
Double chamber, sir.
But I am sorry, double chamber with the APCD.
Good, okay.
Air pollution control devices should be there. Double chamber alone cannot be allowed, but with APCD is correct. Single chamber will not allow. Small scale incinerator will not allow. Drum type incinerator will not allow. Double chamber with APCD is allowed. Therefore, it may be incinerator or conventional incinerator, or it may be a plasma pyrolysis incinerator. Which is the combustion efficiency we have to achieve? What is the combustion efficiency we have to achieve? I told you, if there is a proper combustion, what is the parameter we have to examine? Carbon dioxide is the parameter. Now, when you are estimating combustion efficiency, we have to see what are the CO2 levels in the gaseous emissions. Therefore, then we estimate, and what should be the levels then? CO2 levels, combustion efficiency. At least
99%.
99%. At least 99% is correct.
Okay, continue.
When did the international treaty, like Stockholm Convention, came into force? Stockholm Convention came into force on 17 May 2004. Okay. What is the type of energy used in case of autoclave to treat biometric waste? What type of energy is used in autoclave?
Steam under pressure.
Steam.
Steam is used. Electricity will not use. Petrol will not use. Microwave will not use. In case of microwave, what type of the heating mode we use? Electromagnetic forces. Which form of mercury is more toxic in nature?
Methyl.
Methyl mercury is more toxic in the nature. Mercury is the only metal in liquid which evaporates at room temperature. Therefore, when there is a mercury spill, what precautions should be taken? I told you, mercury is the only metal available in liquid form and it evaporates at room temperature. Suppose if there is a mercury spill, in such a case, what is the precautions you have to take?
Switch off.
Switch on to maintain cool.
Maintain cool.
Switch on AC to maintain cool. Switch on AC in heat mode. Switch off AC in heat mode. Which is the correct? Switch off AC or switch off AC in heat mode?
Switch on AC to maintain cool.
There is also correct answer. B is also correct answer. Switch off AC in heat mode is most preferred one. If it is a like you know, if you go to North India, in summer, in the winters, we use heaters. Other time, if there is a mercury spill, that will evaporate easily. Therefore, the most preferred one is switch off AC in heat mode. And also, this is also correct. Switch off, switch on AC to maintain cool. But generally, the condition is both B and C are correct. There is nothing wrong in it. What is the desired temperature and duration to be maintained to achieve necessary efficacy of treatment of biometric waste in case of dry heat sterilization? I showed you yesterday one method, What is the temperature you have to maintain in case of dry heat sterilization?
180 to 185 degrees.
180 to 185 we have to maintain and not less than 1 hour. It takes minimum 1 hour duration. What is the device used for conversion of electrical energy into microwave energy?
Magnetron, sir.
Yeah. Actually, answer is okay. Then what type of waste cannot be treated by using microwave? Microwave is a technology, a non-bend technology. What type of technology? What type of waste you cannot treat?
Sir, radiological or mercury waste?
Yes, you cannot treat using microwave. What type of biometric waste or source of generation is treated using the equipment called demolizer? I think this I have not dealt, but answer is D. Small amount of waste, sharps and waste can be treated by demolizer. I think so. If you see any non-bend technology, somewhere it has been mentioned in your syllabus. Okay. Under what circumstances biometric waste is allowed to be disposed of in deburial? When you can dispose of biometric waste in deburial?
In common treatment facility not available.
Where healthcare facility is not available? Where healthcare facility is available? Where common facility is not? What is the answer?
Available within 75.
See, under what circumstances biometric waste is allowed to be disposed of by deburial as per biometric waste management rules?
Common treatment facility is
Where
not
common
available.
treatment facility is not
When there
available.
is no common facility is not available. Which is the thickness of HDB liner used as a base liner to avoid groundwater contamination in the second landfill? We have to use 1.5 mm HDB liner. Okay. I think yesterday I told you, when I think day before yesterday I showed you 1.5 mm HDB liner should be their bottom liner. Then only that waste can be disposed of as a second landfill facility. What type of biometric waste can be disposed of by encapsulation?
Sharp waste.
Waste
Waste
charge.
shops. International treaty Minamata Convention deals with what type of waste? Minamata Convention,
Mercury.
mercury, control of mercury emissions. International treaty like the Montreal Protocol regulates what type of waste?
Ozone depleting.
Ozone.
Yeah.
Ozone depleting.
It regulates ozone depleting substances. Remember, just not a credit, you have prepared already. If there is exam, you should be able to write by tomorrow itself. In which year the UN Conference on the Human Environment organized at Stockholm?
1972.
1972 only. After that only, we have come out with the rules called Water Act. Our former Prime Minister Indira Gandhi attended and made a commitment in the UN Conference in the year 1972. Thereafter, they have come out with the Water Act. Ours is the only country come out with the Water Act in the year 1974. Then, which is the primary name of the presently called as Ministry of Environment Forest, which was formed in 1972. Presently, we call it as Ministry of Environment Forest, but earlier in the year 1972, its name is National Council for Environmental Council and Planning is the actual name in the year 1972 when they are formed. Now, presently, we call it as Ministry of Environment, Forest and Climate Change. Okay? Okay, then. Very small questions are there, very. In which year the Bhopal gas tragedy occurred?
1988.
1984. In India, what is the estimated water requirement in hospitals? This I showed you as per the Nation Building Code.
About 410 liters per day.
340 to 450 liters per capita per bed per day. Then, when did Brussels Convention on Control of Transport Movement of Hazardous Waste and its dumping came into force? With May 19. Remember these years, even if you ask me, I can't remember, very difficult. What are the main objectives of Stockholm Convention?
Persistent organic pollutants.
Yeah. To control persistent
Persistent organic pollutants.
pollutants. Yeah. Yeah. Which type of toxic and carcinogenic gases are emitted when PVC, polyvinyl chloride, is burned under favorable conditions?
Dioxins and furans.
Dioxins and furans. We call it as polychlorinated dibenzodioxins and polychlorinated dibenzofurans. Generally, what percentage of total water consumed is generated as wastewater?
80 to 85%.
80 to 85%. Yeah, somebody can. May request. I think so. To switch off your microphone. Praveen Kumarji, please kindly switch off your microphone. Yeah, it is inconvenient. Okay. Name the disinfectant generally observed in high content in the wastewater generated from operation theaters and intensive care units in the hospital. What type of disinfectant do you use?
Glutaraldehyde.
Glutaraldehyde. Yes. Discharge of untreated wastewater into water bodies causes fish kill under what circumstances? Suppose discharge of untreated wastewater into water bodies causes fish kill, which is mainly due to what? BOD will be there, low BOD,
Yes,
low
sir.
turbidity or chlorine or depletion of oxygen. When there is a depletion of oxygen, then fish kill will be there in the water bodies when you discharge any wastewater into water bodies. What is the limit prescribed for bioassay? liquid wastewater should be complied with the bioassays requirement in as per by the hospitals. What that bioassays requirement? 90% survival of fish after 90 hours of exposure in 100% definitely the correct answer. Chemical liquid waste is required to be neutralized depending upon dash parameter to comply to the requirement of armed waste rules.
pH.
pH.
pH. Okay. Then tell me what type of chemical disinfectant can be used for treatment of armed waste?
Disinfectant using 1 to 2% sodium hypochlorite.
1 to
We
2
lost
or 1 to 10 percentage?
2% hypochlorite.
1 to 2, correct?
Yes, sir.
1 to 2 is correct. You all agree? Okay. Therefore, these are some of the questions I just prepared and I just want to discuss with you people. I shared with you also. I hope so you have understood and could able to answer. I think most of you are answering these questions. That means you have understood these topics. Still, can have a look at your syllabus so that that is easy for you people to manage and write your examination. And still, if you feel, sir, I got some doubts, I have to discuss with you, then you can talk to me, no problem. You are most welcome. If I am free, definitely I'll react to you. Or otherwise, if I'm engaged, I may call you back after once I become free. Thank you all for attending my classes, and actually, you all actually involved. I also got some interest. If the strength, the number of people are very less, really sometimes I feel discouragement, and I cannot give I also cannot participate actively. Sometimes I also feel I also feel inconvenient to give lectures. Still, if you feel any questions are there, you can talk to me, or you can ask me now. You got 10 minutes time is there. Yeah, Sophia Thomas, Madam Ji, आप कहाँ से?
Sir, I am from Karnataka, sir.
Yes, you told me, no, you are from Manja.
Yes.
Okay, madam. Okay,
Yes.
then Ravin Kumar Ji, have you understood, ma'am? Any doubts are there still? No problem, madam.
Understood.
Yeah, Ravin Kumar sir, where are you from?
Sir, I am working in an ECHS polyclinic in Azamgarh near Ayodhya, sir.
Oh, you are the right person to have darshan in Ayodhya then.
Most welcome, sir.
And I think so. I visited up to Faizabad. I
That
visited
is the old township, sir. What was earlier
near the
Faizabad
bus
is
stand.
now.
Near the bus stand at the junction, there is a hotel. I stayed there. Then I tried to have darshan of Shri Ram Bhagavanji olden time. I'm talking about 2016. I could not get opportunity. At the time, Hanuman temple was open. I could have darshan. I just came off. I don't know now when I get opportunity to have darshan. Okay, no problem. Present secretary, I know him. Present secretary in UP government, environment department. Earlier he was a member secretary in Uttar Pradesh Political Board. I know him very well. Chagi Saab. I think I know him very well. I hope so. He is there still now as a secretary. I can take his help for having darshan. Anyhow, any doubts? No doubts. Okay then. Then Prakash MG,
Yes, sir.
can you switch on your the camera, please? Yeah. Any doubts? Prakash ji, where are you from?
Sir, I'm from Pondicherry.
Pondicherry. Very good. Any doubts?
No, sir.
Okay, no doubts. Okay, Aswin ji, next. Aswin ji. Any
Sir, I am
questions?
from Telangana.
You're from Telangana, Nicha. Wonderful. ఏ place అండి?
Sir, Mancherial.
Mancherial. Okay. Any
Ramgunam.
doubts? Any doubts?
లేదు సార్ ఇది యాక్చువల్గా ఎన్విరాన్మెంట్ పీజీ డిప్లొమా చేశాను సార్. ఇవన్నీ కన్వెన్షన్స్ అన్ని కవర్ అయిపోయినవి. వియన్నా కన్వెన్షన్ ఇవన్నీ విన్నాం సార్. దీంట్లోనే కెరీర్ బిల్డ్ చేస్తున్నామని ప్లానింగ్ సార్.
Okay, then Arafat, Karusia ji.
Yes, sir. I am from Ahmedabad, Gujarat, sir.
You're from?
Ahmedabad, Gujarat.
Oh, I am coming to Ahmedabad on Sunday. I'll be in Leela Hotel. For 13th and 14th, I'll be there. There is some the training program. I think CPCB has come out with the best available technologies for textile sector. They have visited various industries. They are giving the job to other sectors. I think as a part of that, they are organizing this program. I'll be coming on Sunday. I'll be in Leela Hotel. for 2 days. Then 15th I will come back. Any doubts, please?
No, sir. Thank you, sir.
Okay. Then Manta Panchal madam.
Yes, sir.
Any
Good
questions?
evening, sir.
Any doubts? Good evening, ma'am. Any doubts, ma'am? Where are you from?
I'm from Ahmedabad, Gujarat.
Oh, you're also from Ahmedabad. Okay, very good, very
Yeah,
good.
we and Arfat also classmate.
Okay, both are classmates. Okay. I'm coming to Ahmedabad after 10 years.
Okay.
2014 somewhere I came and delivered lecture there, one lecture there.
Okay,
Now
sir.
I'm
Is
coming
the
after,
Leela Hotel from Gandhinagar?
yeah,
Your
Leela
location?
Hotel.
Gandhinagar, na?
Yes.
Okay.
I'll be there on Sunday evening. I'll be reaching. I'll be there for next 2 days, 13, 14. 15th, I'll come back.
13,
13, 14.
13 and 14. Okay.
Yeah,
If feasible, we will meet you.
definitely. I have given my number, I think so. You people have noted down my number.
Okay, sir. आप chat में डाल देना, हम note कर लेंगे, sir.
Yeah, I think so. My mobile number is, I'm just giving. My mobile number is 98682-78903. And my email ID is jcb.cpcb@nic.in. 98682-78903 and email ID is jcb.cpcb@nic.in. JCB J Chandrababu .cpcb@nic.in. Any doubts,
Okay.
ma'am?
No,
No
sir.
doubts?
It's
Okay,
a very
no
good
doubts.
session, sir.
So, very good. Thank you all
Thank you,
for
sir.
cooperating with me and actually participated. And I also enjoyed talking to you people for last 4 days. And still, if you feel any questions are there, you can talk to me. Anybody is most welcome. Anytime you can talk to me, no problem. Thank you all.
Okay. Thank
Okay,
you.
then.
Thank
Thank
you.
you, sir.
Then
Thank
I
you,
think
sir.
so. Our RC Bhuvaneshwar, somebody is there. Sir, are you there? RC Bhuvaneshwar? RC Bhuvaneshwar, somebody is there? Yeah, I don't know. Nobody's there. Okay, thank you all for attending my classes. Actually, bye. And I wish you all the best for your exam, please. I hope
Thank
so. All of you will succeed in the, the certificate course exam. All the best. Okay, bye.
Thank you,
Thank you.
sir.
you,
Thank you,
sir.
sir.
Thank you, sir.